Welcome to this talk on how to master the ophthalmology portfolio, which is certainly a really crucial step in securing an ophthalmology training post in the UK. So, in case we haven't had the chance to meet yet, my name's Rishi. I'm an ST2 ophthalmology resident working in North London. I managed to score 45 out of 50 in my portfolio, which ended up being a really fundamental step in helping me to do well in the application process and fortunately ranking first in the 2024 cycle. This talk is essentially my perspective on how to do well and score highly, both from my personal experience of what I did to secure the points and also now having a year's experience of helping others secure offers as well. Okay, so just a little bit about iAcademy. If you haven't already, please do follow the QR code on the screen now. That will take you to our WhatsApp community where we have different forums specifically for you guys. We have an ST1 application forum that will keep you updated with all of our future events, all of our limited time offers, and all the different resources that you may find useful. To access our website, it's i.academy. That should take you there. And again, that should show you our library of resources. Okay, so essentially today's talk, um, I'll start by just giving a recap of the application process, touching upon the numbers to again just context set and give you an idea of what to aim for. And so during the presentation, you have an idea of what's necessary versus what's desirable. The bulk of the talk, we will go literally step by step, line by line, through the portfolio, and I will try to outline, my key points of how to shine, how to be successful. At the end, I will do a few of the things that I found were the core tenets of what I thought helped me to be successful, before finally just touching upon the interview. As well, just a quick reminder, this is the second of four talks that we're hoping to deliver this year. The first talk was a couple of weeks ago. For those of you who weren't able to join us, we've now put a recording on our YouTube page, iAcademy. So feel free to go and have a watch or a rewatch if you'd like. And if you're struggling to access it, just give me a message. Looking ahead, we'll have the interview talk in January. I've tried to line it up with the time in which I think that's probably the time where you should start dialing in a bit more to your interview preparation. So for now, don't worry too much. We'll just touch upon it a bit later. And then, based upon the feedback suggestions that you kindly provided during the portfolio, I will try to outline a few of the things people had questions on, in particular, how to triage what to do when, where to maybe spend the money, the short-term versus long-term input required, um, some of the bits that are more relevant specifically to medical students for the points that are only accessible during medical school, and therefore you definitely want to bank. And that's what I've kind of tried to outline with those little icons at the bottom. I've also tried to color code things, very straightforward. The difficult points I've put as red, amber for kind of medium difficulty, and green for the easily achievable points. Okay, so in terms of questions, because there's quite a lot to get through, I'll probably try and take questions at the end. You can put them in the chat. There may be someone around from the iAcademy team that can help answer. The other thing I'll do is I will just, in between certain sections, just double check the chat myself to make sure that I haven't missed anything, or if you'd like me to just quickly explain anything that I may have glossed over, I'll check the chat in between. Okay, so just a really quick disclosure, just to say the information that I'm giving today is very much relevant to this application cycle. Each year, the portfolio requirements will update and change, usually to make things a bit stricter, usually a little bit more difficult, unfortunately. Sometimes it does happen the other way, but generally that's the trend of things. The way to keep up to date with changes year on year is through the Seven Deanery website. So if you scan and follow the QR code, that will take you to the evidence folder. That's ultimately your Bible for all things application process, all things portfolio. And ultimately, the information I'll provide today is an interpretation of those guidelines on the Seven Deanery website, through my own interpretation and also, my own experience as well. I think the Seven Deanery who run the application process for ophthalmology, they actually do a pretty good job of giving their outline of what's scored and what shouldn't be. But ultimately, it still does remain a somewhat subjective process. Okay, so let's quickly start by just recapping the application process. So this is a slide from the previous talk which outlines the numbers of applicants and different stages of the application process. But essentially, there are three stages. Number one is the shortlisting stage. How you'll be shortlisted will be a 50-50 split between your MSRA score, multi-specialty recruitment assessment, and your portfolio self-reported score. Okay. So out of however many people applied last year, it was, over 2,000. The top 350 people who have the highest combined score will then move on to the next stage, which is their portfolio being formally scored by an examiner. Then out of that top 350, your correct score, you could say your formalized score after your portfolio is scrutinized, is calculated, and the top 260 from that 350 are invited to interview. Then, to get the final rankings to deliver offers, it's a 50-50 split between your portfolio score and your interview score. And so, really, I want you to think of it in this way. The MSRA is really a hurdle you need to get over. Definitely not one to be overlooked and taken for granted, but it doesn't end up contributing to your final score. So it's just something you need to do well enough at. This year, they've, I think, made a good change in that they've combined it with your portfolio self-assessment. It takes a little bit of pressure off MSRA. It also then favors people who have been working genuinely and diligently towards their ophthalmology application. The portfolio, in my opinion, is what secures the offer. It's the thing that you can prepare for. It's the thing that has very, clear guidance of what scores points you can bank, as many as you can. And then the interview is what will dictate, just how well you do in the application process and probably dictate, therefore, where you end up training. Again, this is just the way I thought about it, and I recommend you might think about it. Ultimately, it's just a rough rule. Okay, so this is the timeline of events for this year's application cycle. And when it comes to the evidence folder, you have up until the deadline of the 2nd of February to curate and collate your evidence and submit your evidence. And then you'll get feedback for that 2 weeks afterwards on the 16th of February. It's worth saying that after that feedback round on the 16th of February, you have about 48 hours usually to submit an appeal if you feel like you weren't scored appropriately. So what is this self-assessment that I've mentioned and self-scoring? It's something new for this year's application cycle. So this is the detail that I found about it. Essentially, you will provide the deanery, the people leading the application, with a self-score of what you believe your portfolio is worth. And you will have up until that deadline on the 2nd of February to do that submission. And probably that submission will only open around mid-January, when the same time when you're invited to submit your evidence. You will need to score at least 19 to meet the internal cutoff of having your application ratified. It's scored out of 47, and I assume the reason for that is that they won't be asking for your layout mark, which is worth up to 3 points. And it's worth saying that if you falsely inflate your application, your self-score, it does risk your application just being outright rejected And also they've mentioned potential risk of GMC referral and probity concerns. So again, definitely want to avoid that. Definitely not worth that time. It's worthwhile being as honest as you can. So in terms of how actually you'll do it, they're going to trial two methods. One will be a performer, where you'll detail the score that you think you should have for each section with a short description of how you believe you've met those criteria, as well as an online form where you simply just put your score in for each section with no description. Okay, so let's get into the bulk of the talk, which will be the portfolio, of course. So the portfolio has all these different sections, which we'll go through one by one. And on the right, you can see the different scores available, or the maximum score for each section. So 10 sections totaling 50 points. And the numbers I want you to have in your head are 33 and 38. I think if you're able to score 33 and above, you're giving yourself a decent opportunity of getting an offer. That being said, last year I thought the portfolio scores were quite high, and probably to be on the safer side, you would definitely want to be aiming more than 33. But 33 gives you a good shot. Less than 33, it'll be difficult. You're very much reliant on your interview. If you want to apply and enter into training in one of the more competitive deaneries, then genuinely and generally you want to be aiming probably around 40, at least 38, I would say. So why do I suggest these numbers? So these are the scores from last year's cycle. And as you can see, the portfolio scores, the average portfolio scores for candidates entering into these different deaneries is pretty high. And I don't want you to be too intimidated by it. And the whole point of this talk is to explain how you can score that highly and how so many people are able to do that. But it is worth noting you do need to aim pretty high. So, yeah, as we said, probably 33 to 40 is the range. If you can get 40 and above, then you're in a really strong position. What I would say is obviously the more that you can bank in your portfolio, the less pressure it takes off your interview. This year's application cycle, there have been some changes, as I suggested. And because of those changes, I would think that this mean portfolio score should at the most stay around the same. Hopefully, fingers crossed, will come down a bit because some of the changes have made it a bit more difficult to score points. So yeah, just again, take a screenshot, take a picture of this slide, whatever is useful to come back to, work backwards and work towards an internal aim of what you'd like to achieve. Okay, so now let's go through section by section. And it's worth saying that when you come to finally submitting your portfolio, what I would recommend is that you make a PDF collating all your evidence for each section. And then in the portal, you can upload a separate PDF for each section and tag it to that section. The first section is previous posts. It's not a scored section. It's purely to give context to your achievements. And I often a question I get asked is if you get marked for taking years out. No, I'm not aware of that. It doesn't stipulate anything like that. It's purely just to give context. So the first scores section, additional qualifications. So you get 1 point if you have an MSc, BSc, or PG cert. However, it's worth noting that intercalated degrees are not scored, which is a shame. I was certainly in that position and felt pretty hard done by, but it is a cross-specialty requirement outside of the college's hands. And ultimately, what you have to tell yourself, what I had to tell myself was that everyone's pretty much in the same boat with these kind of things. And yeah, so long as you're aware of it, you can kind of account for it. You get up to 3 points for completing an MD or MPhil degree, and you get 4 points for completing a PhD or DPhil. Now, again, I've used the icons here to demonstrate that it's a difficult section to score points in. I personally scored 0 points in this section. Most people I know score zero in this section or score 1 point, so don't be too disheartened. Obviously, if you're motivated, if you want to do a qualification anyway, then it's absolutely worthwhile. 1 point can be really crucial in the end. In my humble opinion, to do qualifications purely for points, it may not be the best use of your time, resources, and money. But again, I'll leave that up to you. Okay, so prizes and awards. You get up to 5 points for this section. And again, context setting, most people, it's kind of a section that you either have the points or you don't. Most people may have 1 or 2 points. Very rarely people maximize in this section. If you are able to, it does help a great deal. Now, the first way you can score points, you can score 3 points for achieving the Crombie Medal, which is coming first in the Part 1 fellowship exam. Now, that is honestly amazing if you're able to do that. It's not really something you can bank upon. It's more if it happens, it happens. Now, the more straightforward but still difficult ones are, for example, coming top 15% of your year group at university for each year. So, what do I mean by that? For example, if you come in the top 15% in your year two, and then come again in the top 15% in your year five of medical school, that will amass you two lots of 2 points and 4 points in total. Um, yeah, that's nice and straightforward. It's worth noting that if you come in the top 15% of your cohort for a specific module within a year, that won't count. It has to be across that whole year. It's also worth noting that, for example, coming top 15% in your intercalated degree, that again won't be scored, which I think is a shame, but it is what it is. Next is national prizes. So with national prizes, you can score up to 3 points. You can score 3 points for coming first place in the national prize, 2 points for coming in the top 10%, or 1 point for coming in the top 20%. Okay. There are a few stipulations as to what counts as a national prize. At the moment, they say it needs to have more than 400 entrants, probably to deter people from entering these small so-called national prizes that don't have many applicants, are from small societies, and try and count that for, 3 points. I think that is unreasonable, or rather a reasonable change from the college. So examples of what to think of. Number one, the Duke Elder exam. If you're a medical school, I would highly, highly recommend and suggest doing this exam, doing it to the best of your ability. It's an ophthalmology specific exam, which I think almost certainly has more than 400 entrants. And if you are fairly committed and spend some time and some good quality preparation, it's something you can score well in. The other thing that I did that other people are able to score well in is, for example, entering things like essay competitions. Now, again, when I did this, when I applied back a couple of years ago, it didn't have the stipulation of more than 400 entrants. And so whether this first place prize would have counted, I don't know, for this year. It is probably a little bit subjective if you don't have the stats to hand. But typically, I think if it's something endorsed and ran by a royal college, then probably is more likely to be accepted. There are other national prizes, so there are other examinations available. I think there's like an annual anatomy or neuroanatomy exam, which is a national exam that you can potentially put in this section. So worth doing your research and seeing what's available. You can score a point for being the lead of a research grant that leads to a first author publication. Again, the details are online. Again, difficult, but if the opportunity is there, worthwhile pursuing. And then finally, the less difficult one, but still difficult, is trying to achieve best presentation or poster in a meeting. Now, that's obviously still very difficult. I wouldn't underestimate it, but the best ways of doing that is number one, obviously doing good quality research or implementation, but then being very strategic about where you present these things. For example, conferences that have student sections or foundation doctor sections are more likely to score well in and win prizes compared to when you're competing, with academic professors, etc. It's worth noting, so previously you would get zero point 0.5 for different prizes, distinctions, merits in modules or in foundation. That's unfortunately been removed for this year. But as I said, everyone's in the same boat. So moving on to the MSF. Now, the MSF stands for multi-source feedback, and it's something you will have to do as a foundation doctor, as part of your foundation program. Essentially, you'll request feedback from different members of the team, be it other doctors, other clinical staff, non-clinical staff that you come into contact with during your job. And you'll collate that evidence, and your educational supervisor will basically read it and stamp it off. Now, you can score 2 points for having all satisfactory comments, or rather good comments and satisfactory scores. If you do have any negative comments or concerns are raised, then you'll score 0 points. In my opinion, you should hopefully almost definitely be scoring 2 points in this section, and I think most people will now. Again, there are a few stipulations to be aware of, but the MSF that you do as part of foundation is essentially what you can upload and evidence for this section. Okay, so moving on to QI and audit. Hopefully you guys have a good idea of what quality improvement or QI is and also the differences and similarities to an audit. This section has up to 5 points, and the different scoring is pretty clear and available on the screen now. Just worth noting, it needs to be within the last 3 years of the interview date. And typically, what I want you to guys to aim for and achieve is a minimum of 4 points. Okay. So 4 points you will get for number one, you need to lead the audit. Make sure you're the lead author on the audit form. You then have to be the one that's personally involved with initiating, designing, and writing up the audit, and being involved in implementing either the quality improvement intervention or strategy, slash making sure it's a complete audit, so completing the loop. That means collecting data beforehand, making the change, and then re-auditing to hopefully show an improvement. Okay. I think those things are pretty achievable if you're organized and start early enough. Again, as a foundation doctor, you will have to show evidence of being involved in audit. So may as well, make it a genuine contribution and a good project. But of course, you guys will want to be aiming above and beyond that for the 5 points, which would require for the audit to be published or for it to be implemented supra-regionally. Okay. I mean, publishing is self-explanatory. It's not always the easiest. It does usually require either, first and foremost, a good, meaningful project, or number two, having a decent project, but with an idea to a good journal that will likely accept it. That, they don't stipulate it needs to be the best journal possible. But for example, if you do an ophthalmology related QI, it's obviously more likely to be accepted in an ophthalmology specific journal. So again, just having those things thought out. And in terms of super regional, I think super regional is quite difficult, and I often get asked what would count as super regional. My perception of that might be, different trusts. I think you could maybe get away with trying to pass that as super regional. Definitely, if you manage to do a national implementation, then that will satisfy this. How you can achieve that? I think if you're a medical student, if you're able to be involved in an audit somewhere in your, final 2 years and implement that somewhere in one of your local hospitals, then probably you're unlikely to be in the same area for foundation training. And so if you do a re-audit then, or, implement that sustainable intervention that you did in med school elsewhere, then perhaps that's then two trusts that you could pass as super regional. The other thing you can think about doing is teaming up with a few other foundation doctors elsewhere around the country or in different regions, working together on a project that you lead on locally in your hospital, but again, can try and evidence as being super regional if it is worthwhile and able to be implemented, across those different regions around the country. But I will admit it is difficult. And again, just some stipulations that some modification of marks will be given dependent on the quality of work showcased. And so here are a few of my tips and ideas for QIs. So just some tips, first of all. Number one, make sure there's, if you're doing an audit, some clear standards that you can mark against and check if your hospital or department are meeting. So, for example, a very quick one I found on the internet was that 100% of patients should have their inhaler technique checked during an admission with an asthma exacerbation. That's a clear standard that you can work against. Number two, once you have your QI/audit idea, make sure it's registered, mainly because that gives you an official registration number. It also allows you to receive a certificate from your hospital's audit department. All of that will prove very worthwhile in your evidence and showcase that you did a formalized project. Some tips to help you, most of all, save a lot of time and efficiency is use electronic data where possible. Most hospitals or departments will have an audit department. And so if you work with them and liaise with them, they can usually help you scrape some of the data from electronic health records and make your life a whole lot easier than going through it manually. And in terms of intervention, again, think strategic about what might be possible and easy to implement. The straightforward things I was involved in have been, for example, identifying a gap and then doing either a teaching session or creating a poster, creating a set of guidelines that are easy to access. The more potentially difficult things might be, implementing a digital alert within your EPR, EHR, electronic health record. Those kind of things I think are probably the most useful to clinical practice, but they require liaising with the IT department, going through information governance, and all these other loopholes and hurdles. So again, be strategic about what you're able to do. And then in terms of ideas, there are straightforward things that are easy to achieve for probably 3 or 4 points. For example, checking if 100% of surgical admissions have their VTE prophylaxis prescribed. Other kind of general themes that I think are useful and easy to audit and improve are things around surgical consent processes, documentation of operation notes, for example. And then good ideas for QIs that I've seen and I've really liked, especially as an ophthalmologist now and getting referrals, is, for example, seeing how well the emergency department staff are able to take readings like visual acuity. Are there Snellen charts available in your local ED? If not, that's something you can, quite easily package, put together, set up within the ED. And I think that would showcase a strong positive, a sustainable change that can improve your local department and patient outcomes. The other general theme that I think is worthwhile thinking about at the moment is sustainability. There's something called SUSQI, which is its own branch of quality improvement, specific to sustainability and reducing waste, for example, being greener wherever possible. There are often incentives, initiatives within hospitals and trusts around this. There are often teams built around this and even funding available to try and make these changes. And so, if you are, first of all, interested in those kind of things, if you have the time, if you're a medical student, I think these are the kind of changes that look very, very impressive are probably more likely to be published and implemented super-regionally, and as well as that be accepted for things like poster presentations. The next section will be presentations and publications. So let's touch upon presentations first of all. So this is essentially the scoring matrix for presentations, of which you can score up to 6 points. I think it's pretty straightforward, pretty reasonable that you score more points for international versus national versus regional, and you score more points for an oral presentation versus a poster or video presentation. Now, the things to be aware of, regional presentations do not include things like your local hospital audit meeting or university meeting. As well as that, it's good to know that accepted presentations that you haven't yet presented before the application deadline can still be awarded points. But I think the best way to try and get 6 points in this section, which I definitely want you guys to do, is to bank as many first author posters at national/international conferences as possible. That's probably the best way of populating your score. If it's accepted for oral, amazing. But for reasons that we'll talk about later, it may be difficult to do that. The other tips I would give is to try and present multiple pieces at the same conference, mainly for a cost and logistics perspective. And for example, currently the Royal College of Ophthalmologists annual congress is taking abstract submissions, and most places, most conferences will be, quite lenient in accepting poster presentations, mainly because they want as many people to attend their conference as possible. So if you're 50-50 about things, just submit it and see how it goes. You'll be surprised as to what might be accepted. In terms of banking the oral points, again, it's the same advice as earlier. Be strategic. Think and look for conferences that have things like a foundation doctor section or a medical student section. I, for example, scored a national oral presentation through the Association of Surgeons in Training. And the reason for that, I think, is because I was accepted into a a prize section for medical students/foundation doctors. So just something to be aware of. And yes, we'll talk a little bit about presentation strategy in a moment. Things to be aware of, and a change that was made first when I applied, is that you can't put the same research work in presentations and publications. Before, when I was preparing, I had the strategy of, okay, every research bit I do, I will present and then publish, and I'll be able to, work smart and put it across both sections. Unfortunately, it doesn't work like that anymore, which is why probably your better quality research, which you're able to publish, is what's more likely to be accepted for an oral presentation, but you wouldn't get those points now. So again, you've got to think strategy. It's also worth noting that for poster presentations, you have to be the first author for it to be counted. Second author will not score points. It does give the stipulation that if you are presenting in place of the first author, then you should get points. So again, just something to be aware of. So publications. Again, quite straightforward, but there are a lot of different smaller stipulations on the 7 Deanery website, so please do read through it. What will count as publications are peer-reviewed original research publications or high-quality systematic reviews. So your genuine high-quality research. You get 3 points for being first author and 1 point for being between second to fourth author. Again, there are a few stipulations that you can look through. But it's worth noting that the quality of work presented and impact of the journal will be considered. So if you think you do have a genuine piece of work that doesn't meet their stipulations outlined, you may still be scored for it. And again, it's just a reiteration that you can't place things in publications in different sections, such as presentations or QI. It's worth noting here that they don't specify the quality of the journal. All I could see is that it just needs to be a peer-reviewed original research piece with a PubMed ID. Now, of course, the best way to do it is through doing good research published in high impact factor journals. However, if you're struggling to bank these points, there are journals that are a lot more lenient in accepting pieces. So, if you are like me when I first came across an ophthalmology portfolio, you will probably have the question of how on earth am I going to achieve all these points? So let's try and break it down because, yeah, research is difficult to get hold of, difficult to complete, difficult to see through, often because of things outside of your control a lot of the times. And it's something that does take a lot of time. So it's worth starting early. So the first thing I want you to do is delineate and differentiate between publications and presentations. And in your mind, of course, the ideal would be to have loads of high quality, good research that you can publish, and then once you've maxed out your publications, you can present the rest of it. In reality, that might be more difficult. And so have an idea of the research you want to publish versus present. And that's what I'll try and touch upon. And really, what it comes down to is that high quality research is the stuff you want to publish, and presentations is something that you need to really hit quantity with through things like posters to try and maximize that score. The way I think you should do it is think about sourcing versus creating your own research. And again, that's something I'll explain now. With publications, this is your original research, high quality stuff. The types of research I would recommend getting involved with to try and publish would be things like systematic reviews. Number one, they are high quality pieces of work. They're top of the evidence hierarchy, therefore more likely to be useful to the profession, more likely, therefore, to be published. The other reason I recommend being involved with systematic reviews is that number one, all researchers will have to do them to essentially showcase that the research that they are doing longer term has a niche. But systematic reviews take a lot of time, they require multiple people, and they're pretty arduous. But as a junior trainee, as a medical student, time and effort is something that you can offer and actually be of value to a research group. The other thing is systematic reviews are things that you can do sitting at home on your laptop in a cafe. You don't necessarily have to be in the hospital. You don't have to be on the ground in the lab collecting data. The other kind of area of research I would recommend trying to pursue, if possible, is retrospective analyses. This is because usually the data is already available. It's just waiting for someone to sift through it, curate it, interrogate it, and piece it together, rather than prospective data, where you'll usually have to spend, many a month collecting the data without real knowledge of even what this data shows, if it's going to be useful. And therefore, it risks spending a lot of time with potentially, variable output. So just something to bear in mind. The other question is how on earth then do you go about sourcing these kind of research and approaching people? Genuinely, it's just by speaking to people and asking people for opportunities. You can definitely be strategic about it. The best thing I did to source research was simply cold calling different professors. And I should quickly stipulate that none of this research has to be within ophthalmology. Your presentations don't have to be in ophthalmology. Your audit does not have to be ophthalmology related. So, yeah, I just emailed a bunch of different professors. To be strategic, I would recommend maybe looking up at the professor. Number one, first and foremost, making sure it's something that you're interested in. You're more likely, therefore, to be personally invested. You're more likely to form good relationships and even get good outcomes because of that. Number two is to see the person you're contacting. What is their publishing track record. If they haven't published for a few years, maybe they're involved in much longer studies that you may not be able to see through within the time period you want. On the other hand, if they're pushing through different papers regularly, then perhaps they would be a suitable supervisor to help you see something through within 6 months to 2 years kind of time period. That being said, you will be surprised where you get research opportunities. For me, I got one opportunity literally through speaking to someone in the queue at Costa at the hospital who, put me in touch with a professor. And it was a completely serendipitous event. Had no idea who this person was beforehand. And yeah, so you never know. So just eyes and ears open as much as possible. Okay, so now how about presentations? So number one tip, present everything that you can, everything that you're involved with. And by that I mean presentation, audit. There's obviously the stipulation if you publish the audit, then you can't then, present it and put that in the presentation section. But if you're not able to publish your audit, then 100% present it. You've done the work, you've done the hard part, just submit it for presentation somewhere relevant. Even essay competitions, some places will accept it. Even, for example, my Royal College essay that I won, I was able to submit that to the Royal College Annual Congress, and they accepted that as a poster. Two birds with one stone, working smart, working efficiently, makes your life a whole lot easier. So yes, present everything. Now, what do I keep uh, referring to in terms of sourcing research? Essentially, what I mean by that is there's some research that you're able to do without a professor, without a consultant, without a great big supervisor. And examples of that, I'll give you examples that I did. So I ran a teaching course for on the oncology module at my university through one of the societies, mainly because I found it really difficult in my preclinical years to learn all that kind of biochemistry. And so I wanted to try and teach it in a different way. And so when I did this teaching course, I ran it in two parts. I ran it as a didactic lecture series in one part, and then in the second part as a tutorial system in small groups with worksheets. Now, I did that, of course, because I wanted to. I did it with a friend, really enjoyed it. But what I did is when I was collecting my feedback, I added in some research questions around what people found useful, etc., etc. I managed to package it all nicely together, and it was accepted as a poster presentation at an international conference, which was, priceless points. And you're going to have to do things like teaching anyway for your portfolio. So you may as well try and be smart about things, marry it up with research that you can do without a supervisor between a group of friends and present, at good conferences. And yes, we touched upon it, combining teaching, audit, all these other things. Okay, so it's probably a little bit of information overload. So just while I give you a quick 30-second break, I'll let you know about our portfolio review service that a lot of people found useful. We essentially offer a one-to-one portfolio feedback session through iAcademy with a trainee that scored more than 42 or 42 and above in their portfolio section, putting them in the best position to give you feedback and advice and ideas of how to do well. Within that session, you'll get a portfolio score estimation and an action plan of what you can do moving forwards. You'll also get access to our letter templates to ensure that you are getting the marks that you deserve. And also you get access to our formatting guide, which will help you to score hopefully 3 points. And everyone that's used the formatting guide so far has scored 3 points, which is worth nearly the same as a PhD. So very much worth investing your time into. I think it's useful mainly to have a second marker, a second set of eyes to make sure you're not missing anything obvious, a way of looking at and identifying last minute available points. The main thing is probably portrayal of evidence. Everything I've said so far has probably felt pretty black and white, but in reality, the things that we do may or may not fall into different buckets. And so it's a way of strategizing how best you can showcase your portfolio and evidence to make sure you're maximizing your score. And then, as we said, just trying to get advice and a framework to secure those 3 points for presentation marks. You can book online via the iAcademy website. And if you have any queries, if there's a certain trainee that you want to do your one-to-one with, that may be booked up, for example, just drop me a message. I'll try and facilitate as much as possible. And in terms of feedback, I'll first and foremost say I don't want you to feel like anything is an essential requirement, but we have received good feedback for the portfolio review. I think it is useful. 92% of people who've had one said they would recommend it to a friend applying, and it's received a quality score of 4.8. So again, just something to be aware of. So let's get back to it. Last few sections, nearly there. So education and teaching. So you can score up to 5 points for education and teaching. And again, there's different brackets and different ways of scoring points. Within each of the brackets, it will tell you the maximum score available. So for example, the first bucket, you get zero point 0.5 points for each of these things, up to a maximum of 2 points. The way to score them is number one, helping out in an educational course, one or more than one session. Very easy, very achievable. Contact things like university societies, hospital courses, foundation training, all those kind of formal teaching processes. See if you can contribute a couple of sessions to them. For myself, I managed to do some stuff back at my university and delivered a couple of tutorials for the first and second years. And that was how I showcased these points. Again, helping out in mock OSCEs, very easy marks. Get in contact with university societies, get in contact with your local undergraduate department at your hospital. Worst comes worst, just work with a few other doctors or trainees and set up your own mock OSCE. E-learning tool is a bit more difficult. Things you can do for that, create things like online flashcards that you can distribute and get feedback on. You could write SBAs, for example, for iAcademy, or even for places like the Royal College of Emergency Medicine. I think accepts a lot of SBAs and things like that. Just keep an eye on that. Ebooks are a bit difficult. I'm not too sure of any, bona fide ways of doing it, but again, worth looking out for. Teach the teachers courses. Again, a bit of a tick box thing. There are different ones available. There are a few free ones on Coursera, NHS Future Learn. I don't know necessarily if all of them will count as marks, mainly because you can literally click through them and get the certificate at the end. Probably more formalized ones. The one that I did was from Oxford Medical. It was an online course that I did in an evening or maybe a day. It was around £70. I had a quick look today and it was 170. So again, maybe just do a bit of shopping and see what works for you. Again, formal role in examining undergraduates, contact universities, contact local hospital departments. And it's worth saying here, duplicate experiences will not be scored. So you can't do multiple educational courses and hope to maximize the 2 points that way. But I would hope that you try and get four different lots of zero point 0.5 here to get 2 points. You get 1 point for delivering three formal teaching sessions over at least 3 months with formal feedback. And I should stress, for anything you do, make sure you try and get formal feedback. Okay. Yeah, this is nice and straightforward. It says here 1 point each and maximum. Didn't have this wording before, and I'm not too sure how to interpret it. My gut instinct is that it means you can only score a maximum of 1 point for this, and probably duplicate experiences won't count. There is a caveat to that we'll touch upon, but it's, yeah, just something to be aware of. You get 2 points for doing a higher teaching qualification, for example, a PG Cert in MedEd or a diploma. Again, it can be valuable, those 2 points, but they are usually quite expensive. The cheapest PG certs, probably about 2.5 grand, can go up to probably 8 to 10 grand. So do your research, see what works for you. I personally didn't do a PG cert, but at the time that I applied, they were a bit more lenient with cumulative scoring. So I think that's what allowed me to maximize in this section. Whether I would have maximized now with the portfolio I had, I'm not too sure. And then the harder things are for being involved in writing a chapter for a postgrad level academic textbook or, being the lead author for one. And then what I was trying to kind of allude to here is that it says evidence cannot normally be used in two different domains. For example, PG Cert can't be used in two different sections, and also multiple experiences in similar areas will only be given points if additional attainment is described. So, what do I think they mean by that? Or how I would try and showcase that is number one, different topics, maybe different teaching method, different cohort of students, different setting, university versus hospital, etc., etc. That might be a way that you can try and showcase multiple experiences. And then again, somewhere like a portfolio review, we can strategize how to actually showcase and evidence that. So what I'm hoping is that maybe you can score 2 points from those zero point 0.5 buckets, and then maybe a couple of 1 points if you are able to achieve that additional attainment. That will take you to 4 points, which I think are nicely achievable with some hard work and dedication. Probably to get 5 points nowadays, it is looking like it's more of a requirement to get the PG cert. But again, you don't have to maximize on every section. So the largest section, perhaps the main section that we'll try and rattle through is your essentially your commitment to specialty. So this is nice and straightforward. I won't spend too much time going through it. You get 1 point for doing the refraction certificate. I think if you're an optometrist applying, then obviously you get the 1 point anyway. You get 3 points for passing your FRC off the Part 1 fellowship exam, and you even get 1 point for purely attempting it. That 1 point incentive wasn't there at the time I applied. And so a question I often get asked is, did I do it? And I personally decided against doing it at the time. The reason being is I felt like I could get at the time what was 12 points without it, and I was able to do that. Now, having, started foundation training, ophthalmology training, it would obviously be nice to bank it earlier, but also personally, I wanted to concentrate on things like the MSRA exam, and so I don't think it's a necessity to do it early. The 1 point incentive probably does make it a bit more worth your time. And then you get up to 2 points, zero point 0.5 each for non-peer-reviewed case reports or letters related to ophthalmology, or you get 1 point for other research that's over overspilling from your publication section that you didn't include within that, provided it's related to ophthalmology, of course. So where can you go to submit these kind of things? I put a range of different areas on the side. The Ophthalmologist and iNews are very good journals, online journals and magazines that I personally did my non-peer review work in. You can probably have a search through and see the kind of things I wrote about. Again, other places, Mind the Bleep is a really good medical education website. They often take different ophthalmology related educational resources that you can contribute. Even us at iAcademy, we're happy to try and help you write stuff for our website that other people might find useful. And that's something you can try and evidence as non-peer reviewed. Then, you can be creative. There's the BSDJ, which is the British Student Doctor Journal. Again, it's something that you can quite reasonably write about as a medical student and foundation trainee. And there are these websites and journals like the Journal of Foundations of Ophthalmology, which are pretty reasonable with accepting things. So again, have a shop around, see what works for you, write about stuff that you're interested in. You then get 1 point each for an elective or separate undergraduate experience in ophthalmology, up to 2 points. 1 point for doing a taster week in ophthalmology. And again, a taster week is something you will all have access to as a foundation trainee. Some places will say you can only do it in F2, but usually if you speak to your TPD and educational supervisor, you can do it earlier in F1, and that way it helps you bank the marks early. Or if you have a foundation job in ophthalmology, that again will count as a point here instead. Ophthalmology shadowing. This is again during your F1 and F2 years, going in on your 0 days, on your days off to shadow ophthalmologists, pardon me, in the clinic or in theaters, and usually about 10 sessions are required. Then there's up to 2 points, one for each experience for doing ophthalmology simulation, such as the IC simulator. And if you follow this QR code, it will take you to the web page that shows you where all the different IC machines are available. After that, it's worthwhile just contacting that department, try to contact a consultant who can supervise you. Usually you have to do 4 hours to get the point for IC and a second experience of ophthalmology simulation. Ways of doing it. So there are usually microsurgical skills courses in ophthalmology available. There's the Royal College's Introduction to Ophthalmic Skills course. These can often be expensive, but just be aware you should have a study budget available, either as a set code as a foundation trainee, or you can usually discuss with your TPD about discretionary study budget for things like these courses. And again, that was something I was able to do and get over a grand expensed as a foundation doctor. So well worth your time and time investment to save money investment. And then you have up to 3 points for meetings attended, with more points being allocated for national/international meetings attended versus local meetings. Now, again, it's worth knowing and stipulating that if you're presenting at a meeting, an ophthalmology meeting, you can't then put that meeting within this section. You would have to attend another meeting. So, what meetings to know about, what to be aware of? Again, if you want, you can contact me. I'll give you a list of what I think is good. The one I would recommend is the Royal College Annual Congress. That's probably got the most stuff that would be digestible and reasonable for a foundation doctor versus the subspecialist meetings where a lot of it might go over your head. And now the second QR code will take you to, I believe it's iNews, their calendar of all the different meetings and events happening. And that will be, a much bigger repertoire and library than the things I would know about off the top of my head. So worth going through there and ticking through them. And yeah, and seeing what kind of meets your fancy and meets your schedule and rota. I think the Royal College of Medicine or the Royal College of Physicians, something like that, they hold ophthalmology evenings, and those are quick and easy regional meeting points that you can attend online. Okay, the last thing that I want you to think about and not overlook is that you can score 2 points for discretionary marks. People often overlook these because there's nothing outlined, but I think so long as you're showing a genuine interest and commitment to ophthalmology, they should hopefully be counted in discretionary. So some examples, holding an ophthalmology society position, for example, being president and delivering a conference, being part of a formal research group for a number of months or years, working with an eye-related charity closely, completing an online ophthalmology course, even, attending future further events. There's a Royal College event, which is like a student ophthalmology day. For example, something like that, I would imagine should get points scored in this section as discretionary. But as the name suggests, it's discretionary. It'll be up to the marker on the day, and it's yeah, up to you to try and showcase and evidence it for them to allow them to score you. And yeah, even though it's the biggest section, I think it's somewhat the easiest in that it just requires organization and a bit of commitment. And I think out of the 13 points available, 12 of them here are achievable. And that's what I've tried to triage here for you. So just rounding up for the last few minutes. The last section is portfolio layout, very straightforward. You'll get maximum points for a well-organized, clear, easy to access portfolio. You'd imagine that everyone scores 3 points in this section. In reality, most people end up scoring one or two, which is a real shame because you spend so much time on the rest of your portfolio. And often it's the people who have spent a lot of time on their portfolio and have a lot of evidence, they're the ones that find it more difficult and they end up not scoring 3 points in this section. What I recommend is, first of all, submitting a different PDF for each section and tagging it accordingly, and then actually having a contents page for each of the sections to help your examiner go through. And again, with a portfolio review and things like that, I will share with you how I did things, and you'll get access to the iAcademy templates. The QR code now on the screen will kindly take you to our feedback form. If you are able to fill in feedback, I'd be very grateful. And perhaps most useful to you guys, I should have a section there which requests any other things you want me to cover now for the next talk, which will be interviews. But yes, otherwise, what I've done here is I've put together all the green points that I triaged throughout the presentation and what's achievable. So I've kind of said here that, prizes are difficult, qualifications are difficult. Presentations and publications, you want to be aiming for at least 4 out of 6 minimum to give yourself a good chance. And otherwise, all the other green points will take you to 32 out of 50. And remember, that was my kind of base for getting an offer. So all those green points, which are achievable, just require things like hard work and dedication, will get you to a good base to get an offer. Obviously, to try and get more than that to achieve a higher score, a more competitive location, that's when things like maxing out on presentations or publications, getting a few prizes under your belt can quickly take you up to that 40 range that we suggested would be a good aim. So now just looking forward to the next steps in the last couple of slides. March is when you will, fingers crossed, be invited for your interview. And the 19th of March is when you would receive feedback for how you did on the interview. And as I said, you don't have to worry too much about the interview now, but have a good idea of what is involved in the interview now. The reason being is you're going to do all these different things ophthalmology related. What you want happening in the background, cooking away, is all these different experiences you're having, you're hopefully putting into the context of the interview and starting to build a framework of what might be useful. For example, things like the shadowing sessions that you're doing, trying to pull information from those sessions that will help build towards your interview. So just a quick recap. The interview is 2 online stations, 10 minutes each. Both stations are simulated patient consults where you'll be discussing directly with the patient online. The first station, the assessment will be around your clinical knowledge. The second station will be around a difficult communication or ethical scenario. These are the resources that I recommended that you think about. Again, you can listen back to the first talk where I touched upon it in more detail. And in the talk in January, that's when I will, really go through interview in the same detail as we did portfolio today. And when to start really honing in your interview, probably literally the day after. Okay, maybe not the day after, give yourself some break. But after the MSRA is when you want to start, dialing up your interview prep. And unfortunately, you kind of have to be preparing for an interview even before you know you're invited to give yourself the best shot. In terms of resources, if you're going to get one resource now, if you want to kind of get the ball rolling and get a feel for things, it would be the interview bank. That's what will give you the most context, allow you to practice with a couple of friends, get a feel for things, build up a picture, receive some feedback. And again, it will allow you to put all your clinical experiences into that context. And then in terms of the iAcademy interview bank, we have now 50 plus high yield stations with detailed feedback, mark scheme, difficult scenarios, which are going to really push you and make you, the best applicant you can. I think 50 stations, 50 plus, true stations is the most, I think, out of all the other banks I can see. But I would recommend that you go and do your own research and see what's useful for you. Within our online interview bank, you can practice alone, you can practice with a partner that you sign up with. We are also really amazingly, excitingly going to be implementing an AI patient, hopefully, which will allow you to practice by yourself as much as you'd like, as much as you can, and get feedback from. And yes, everything has detailed mark schemes with guides, all based upon recent cycles, inspired by recent stations. If you have any questions related to the interview bank, please do message me, and I can try and help you out. So the last thing I'd like to leave you with are just a few of my keys to being successful and yeah, hopefully doing really, really well. Number one, it's so obvious, but so important. Be organized. If there's one thing you do after this, go through that 7 Deanery website, make a self-assessment score of what you're scoring now, and create a plan and a triage system of how you're going to get to the points that you're aiming for. Secondly, aim high. Don't put a limit on, sections where they have achievable marks. Okay, things like extra degrees, maybe you have to concede, but for other sections, try and maximize as much as you can. You'll be surprised at what you can achieve. I definitely didn't go into the process thinking I could achieve as high as 45. I don't think I did anything supernatural or completely crazy. I think I was just, fortunate, had good people to work with, was able to work hard, smart, and diligently. But yeah, definitely aim high, especially if you are, you know, prior to F2, F1 medical student, everything will typically change year on year, get slightly harder and harder. So the more that you can maximize now from early on, the easier those changes will be for you. Work hard and smart. I've hopefully touched upon it throughout, but for example, doing for me, what a great example of that was doing my essay competition, fortunately winning the prize, but then also that essay competition I was able to present. I published as a non-peer review journal in a non-peer review journal. I was also the prize from doing that essay competition was free entry to a conference. And so I was managed to tick a lot of different things with one application. So try and be smart, but you still have to work hard. Align interests with points. I think this is really important. And hopefully you are naturally interested in most things you do anyway, because they should be ophthalmology related. But if you're doing things, purely to tick the boxes, it can be really really tough, really monotonous, really dissatisfying, demotivating. On the other hand, if you find people that you enjoy working with, research that you're interested in and passionate about, then suddenly it really does become, true self-development. And that's the reason for the portfolio in the first place. You make really good relations that end up lasting your whole career, and you're more likely to get good outputs. Write your own letters. So you want to make sure that the evidence that you provide in your portfolio is honest and most of all, showcases what you've done to make it easy for the examiner to give you points. The last thing you want to do is spend all your hard work and effort doing something, not putting in those little stipulations, more than 3 months, number of sessions, etc., and not scoring those points. That would be a real shame. So I suggest that you write your own letter with those key things highlighted, and then ask your supervisor if they're happy with it for them to edit it if they like, and then just, sign off on. And that makes it easier for both of you. Don't sleep on layout. We've talked about it. It's really important. I want you guys to get 3 points in that section. Spend money wisely. Again, I've hopefully touched upon ways that you can save. There was another thing I wanted to mention regarding that. Things like conferences can end up racking up a really high bill. Think about attending international conferences that happen to be in the UK for that year. Also, with these large conferences, if you offer to help setting things up before and cleaning up afterwards, they will often either waive your attendance fee or reduce it. So again, that's a way of being able to be smarter with money. And then make sure you're maximizing as much study budget as you can. You know, that money is available. Yeah, which is what I mentioned there. And the last thing is a lot of people sometimes actually, some people end up getting less than probably what they deserve in their portfolio. If it happens to you, don't be too discouraged because it happens to a lot of people. You can put an appeal in, and often people do go up, even by 4 or 5 points I've seen. So yeah, don't give too many second thoughts to appealing. Perfect. Thank you so much for sticking with me, bearing with me through a really heavy session. I really appreciate it. If you haven't already, please do join our community through the WhatsApp group with the QR code on screen. You can find my number there. Feel free to message me. I do sometimes take a while to respond. So yeah, feel free to double text and all those kind of things as well. You have my email there, you have my LinkedIn. More than happy to try and help you guys as much as I can. And again, just looking forward to the next session. Um, in fact, we don't have the dates here, but I'll put it in back in the group. Um, but yeah, we'll have our next talk in January for the interview. And yeah, just believe in yourself, guys. You can do it. You can get there. It is intimidating, but hopefully you can break it down like I have done today and just slowly tick those things off. And hopefully I'll see you on the other side.